will use gloves for this one, unless you want gastric contents and spit all over you. So, going into the patient's room, hand sanitize, clean your hands. You want to introduce yourself to the patient. Hi, Mrs. Tinkle. My name is Sandra. I'm going to be your nurse today. The doctor has ordered an NG tube for you because your nutrition lately has been very poor, so we need to supplement it with some feedings, okay? Have you ever had this done before? Usually most patients have not, so you want to explain it to them. What it is a little tube that's going to go into one of your nostrils, and this one is going to be in your stomach, and it is uncomfortable going in, but once it's in, you won't even know it's there. It just depends on how you move. But shouldn't be too uncomfortable, okay? Going in, it will be. So just let me know if it gets too uncomfortable. And I'll be looking at you, assessing you, making sure that your respiratory is okay as we're doing this. And I'm going to put your head of bed up, okay? So put the head of the bed up. The higher the better. At one point, they are going to have to put their head back and then down to the chin. So you might want to remove a pillow if they're too forward. Okay, and put this on there. Get this ready, and at this point I put on some gloves. Make sure I got the pin light. Okay. And tape. Can somebody get a roll of tape? It's up to you if you want to do your tape before. For this one, I like to do it before because you run out of hands. I like to cut out. You have to anchor this temporarily. If your facility is x-ray, you don't want to connect it all the way and then it's not deep enough. A lot of times that's usually our problem. We're not deep enough. If we happen to go into the wrong place, for example, let's say maybe we go down to the bronchos or the lungs, the patient will immediately desat. They'll look very uncomfortable, so we tend to know pretty quickly if we're not in. Okay, so let's get our stuff ready. You want to get your lube, out. Well, before you do that, you just want to have it ready to go. You can pour it out here if you want now, put it here, but you need to measure your patient. Okay, Miss Tinkle, I'm going to measure. So it's going to be from the tip of the nose to the back of the ear, all the way down to the xiphoid process. So you kind of have to feel for it. For these mannequins, it won't go all the way through just because of the way their structure is. But this is about our size. You want to go ahead and lubricate at least about 2 inches. Like this. Okay, put this back. I want to examine my nostrils. See which one is better. Ask them if they've ever had any kind of nasal surgery, or if a certain side seems to be more bothersome. Sometimes it's good to have them blow their nose too, in case they have a lot of mucus in there before you go in. You do want to assess the mouth, and part of your assessment includes knowing why this is going in. So in her case, it's nutrition purposes. Okay, so now that we have all that, we can go ahead and start. As soon as you go in, you want the patient to kind of put their head back, and if possible, you want to have this here. So you're going in with gloves, and as soon as you get to the back, and you can feel that, you tell the patient to kind of just hold on. You're looking and see, and I can see back there that my tube is going right down. Okay, at this point, you want them to tip it to their chin, to their chest, and have them swallow. Swallow sometimes helps if you kind of do a rotation. It helps. Okay, and keep going all the way until you reach your mark that you did on your Salem thumb. we're down there, so let's tape the temporary. Some say anchor it with like a safety pin or something here. You can do a slight one there. Make sure that this is on the closed side. So now we need to check placement. I'm going to first check to see if I can get a little bit of stomach content. Connect it. All you need is very little. You don't need much because your strip is very small. You're going to get it here. You're going to put it in your pH strip. Make sure that it's less than 6. You know you're in the stomach. That indicates we're in the stomach. Now you still have a little bit left, so you can actually now put air as well. About 20 to 30. Here. Listen in the stomach. And put this back in. Okay, and you should hear a nice swooshing sound. For your safety and for your documentation purposes, it's always better to get a second nurse to check that as well. If for some reason it curls and keeps coming out, you might want to try the other nostril if it's not contraindicated. And you might also try to use water. If you're trying to go in dry, with water it helps, or just having the patient tell them to swallow and swallow as you're going down. Documentation, you're going to document the size, you're going to document how the patient tolerated, your method of how you checked it, whether it's in, and before you leave, clean up the patient, make sure they're comfortable. If you're going to need an x-ray, let them know that x-ray will come, but make sure that it's supported enough where it's not going to come off, because you don't want to put the full dressing if you need to verify with x-ray, just in case you need to advance a little more. That's basically it. So once x-ray is verified, you want to come and do another type of dressing. I like to do one where I can put it one full tape in the nose, or Tegaderm seems to work really well. And close around. That tends to stay pretty well. And if you have a safety pin, you can put it here, and do give them enough slack where they can turn their head back and forth. You don't want this to get stuck, because once they do a turn, this will slide right out. Just make sure I didn't miss anything. I think that's pretty much it. It's a very simple procedure. The hardest thing about this is the discomfort for the patient. Otherwise, it's pretty simple.